according to the American Heart Association statistics, which is available on their website, there's about 120 million adults in the US who have high blood pressure. And what's interesting is that about half of those people don't even know they have high blood pressure. A quarter are considered to be well controlled. So that means that 90 million adults in the US currently have high blood pressure that is not well controlled and are at increased risk of various complications related to that. So, there's good research data now that indicates that people who have underlying cardiovascular disease, and particularly high blood pressure that's not well controlled, those individuals are at increased risk of serious complications when they get sick with COVID-19. And those serious complications can include the need to be hospitalized, have to go into an ICU, to potentially need to go on a ventilator, and to have what are called major adverse cardiac events, heart attacks and strokes. So for those reasons, there's a tight relationship between uncontrolled high blood pressure and complications related to COVID-19. That's a great question. And according to the numbers that I saw recently, we're now in the second month of February. Numbers from the Centers for Disease Control and Prevention, only about 22% of the US population has been vaccinated this season against COVID-19. That's a really low number. For comparative purposes, approximately 47% have been vaccinated against influenza. That's not a great number either, but at least it gives you a bit of a benchmark. So 22 is, we could be doing a lot better. I think that the major reason has to do with vaccine fatigue and COVID fatigue in general. People have been dealing with this for a long time. They've turned their lives upside down to react and respond and take care of their loved ones. And I think people want to move on, and they don't want to think about COVID-19 or take any action. That's human nature, and I think we all kind of understand that. The problem, of course, is that COVID-19 has not moved on from us. So it's still very much a virus that's circulating and causing illness, causing hospitalizations and even deaths. And we have to use these opportunities like American Heart Month to capitalize on times when we can refresh people's memories and help them focus on some of these real public health issues that they should be attending to. Well, there are two types of vaccines that are licensed in the United States and available. One is the vaccine that our company, Novavax, manufactures, which is a protein-based vaccine. And the other type is the so-called mRNA vaccines. The protein-based vaccine is one that is based on a technology that's really been around for quite a long time. A lot of people are probably familiar with flu vaccines and hepatitis B vaccines, pertussis vaccines, which have relied on this well-established technology. In our case, in the case of Novavax COVID-19 vaccine, we combine the recombinant protein with another substance, an adjuvant, that works by enhancing the immune response. So the protein plus adjuvant together result in a more enhanced immune response than to the protein alone. So those are the two options available in the US. I think it really gets back to the point that you were making a moment ago, right? That that vaccination rates are low, and that we can be doing a lot better, and we should be doing a lot better. And it's important to remind everybody, particularly during American Heart Month, when we think about the risk of underlying cardiovascular disease, uncontrolled high blood pressure, and severe complications from COVID-19, that those are the people who are at particularly high risk, and who, if they haven't already gotten the updated COVID-19 vaccine, really ought to take another serious look at that.